The immediate challenge of the impacted hospitals is to preserve the accident and emergency services. What we're seeing is that a lot of people are coming in now to these facilities with trauma related to falls from the roof, from ladders, nails penetrating their feet, other objects, getting cut. They're really trying to pick up at the pieces, and in doing so, it's creating some accidents. This is beyond the extreme situation of deaths that have been discovered and are being retrieved, unfortunately and tragically. So the A&E is where the absolute priority is, and so there are a couple of things that are required for A&E to function. First of all, the staff, and we're reaching out to the staff to give them some support so that their own welfare, even with the inconveniences, can be addressed. But we need water and we need electricity in the first instance. So I can report that we have made arrangements. These institutions have backup generators. There's no electricity. We have made arrangements for ongoing supply of fuel for the generators, and that is in place. And so the electricity on the compound is, in the first instance, supporting the accident and emergency functions and the supporting services for accident and emergency to function. That would be the lab services, the diagnostic services, to the extent that those equipments are functional. And that's the instruction, and that's the work that the team on the ground are actually working on. The other is communication. We had serious communication issues. We have now put in place the satellite phones, Starlink, I think they're called, at each of those locations so we can communicate. Previous to a day ago, it was difficult to get information in and out of those locations. So we've made the arrangements to put that in place. The other is water. And we've worked with the NWC, Minister Samuda, and others to ensure that the institutions get a daily supply of water. Water is critical, as you know, for infection prevention and control, for treatment, for dialysis, and so on. So those are the basic minimum. In addition to that, trying to ensure that there is a covered space, because some of those areas actually are exposed to the elements. So if it rains, then clearly it compromises the service provision. So I'm relatively pleased with the approach to getting A&E back up and functional.